As Omicron is now the dominant strain in the US, the booster drive is intensifying. This fast food outlet in Chicago was turned into a vaccination centre, with prizes on offer for those turning up to get jabbed. President Biden has now announced plans to deliver 500 million free tests and expand the availability of vaccines. Quite a different approach to Omicron compared to the Netherlands, which is now in day 3 of lockdown, leaving Dutch cities deserted and businesses in despair.
Now, we don't have that clients anymore, so lose a lot of money.
My job consists of booking agents, artists that perform at venues. And if there aren't any venues open, we can't put any artists there. And no artists means no entertainment, no money.
In China's Xi'an city, dystopian pandemic scenes have unfolded again. Only 52 new COVID cases were detected, yet 13 million people have been ordered to stay at home. One member of each household will be allowed out once every 2 days to purchase necessities. And everyone will be tested. While Japan confirmed its first local Omicron transmission in the city of Osaka, the country is tightening quarantine rules for those in contact with Omicron patients, requiring 14 days of isolation at designated facilities. In Spain, wearing a face mask outdoors is now going to be compulsory again. In several countries, COVID cases appear to be rising rapidly, likely the Omicron variant. Currently, Denmark appears to have the highest number in the world. Cases in the UK have been steadily rising. In the Netherlands, a lockdown is now in place. Case numbers there are falling, but it's too soon to see the impact of restrictions. Over in the US, cases are creeping up. While in South Africa, experts say the Omicron strain has passed its peak.
We see huge number of infections, but when we look at the hospitalizations and other severity markers for disease, we don't really see that much severe cases with Omicron. So I think it's really telling us good news.
In Israel, 4th doses of vaccines will now be offered to those aged over 60. For now, the only place to do so, but perhaps an approach many other countries will take yet. Or are we closer to treatments? Federal regulators in the US have just approved their first COVID treatment pill. The Pfizer Paxlovid drug can be given to high-risk patients aged 12 and over within 5 days of showing symptoms. Well, in response to the latest wave of the Omicron variant cases around the world and the need for vaccinations, the World Health Organization today has dramatically called for a moratorium for rich countries with expansive booster jab campaigns to instead provide vaccines to the rest of the world. A little earlier, I spoke to Dr. Catherine Smallwood, who is the Senior Emergency Officer at the WHO's Regional Office for Europe. I began by asking her what we should make of initial reports from South Africa that Omicron has not caused as many hospitalizations and deaths.
Well, it's very much preliminary information coming from South Africa. And we did see an increase in hospitalizations with the Omicron surge. But what's also true in South Africa is that there's widespread population-based immunity and including increasing number of people being vaccinated in South Africa. And so all of these need to be taken into account. And what we're seeing in the UK and in other European countries at the moment is that Omicron is spreading in highly vaccinated populations. And it's very likely for that reason that we are seeing milder outcomes. The big question will be when it spreads in countries with much lower rates of immunity, through vaccine-derived protection or natural immunity.
And on that point of vaccines, the WHO is calling for an end to rich countries boosting their populations. Why?
That's not actually the case. WHO is not calling for any end to booster programs for people who are at risk of severe disease. WHO is calling for a prioritization that boosters go first into those people who really need it, that are at more risk of having severe COVID-19. And because there remain very large numbers of people around the world that are at risk of COVID-19 and have yet to have their first and second doses, this is why there's a real need for us to take the inequities that are currently dominating the world very seriously and to take action against that. But it's certainly not to say that people shouldn't get a booster jab if they're offered one. That's really important right now, both for people who are at risk of severe disease, but also people who are working in care settings and in hospitals.
But essentially you're saying that healthy adults in richer countries shouldn't be offered boosters before everyone is offered a first dose in poorer countries?
We're not saying that. We're saying that countries really need to take the question of inequities around the vaccine very seriously, and that in all countries, people who are at high risk of COVID-19, severe disease, forms of COVID-19, should have access to their first series of vaccination and a booster. And we need to do more to make sure that the rollout of all vaccines is done equally to those populations across the world.
So what more needs to happen in terms of rolling out vaccines more widely around the world?
Well, I think the message is that richer countries need to do more to plan ahead in terms of not buying up the entire stock of vaccine, in terms of not just handing out vaccines when they're about to expire, but planning this, building this into their own national planning in a way that we take into account the local populations, the populations of the rich countries, but also think about the populations that maybe need more access to vaccines, the countries that have the capacity to deliver them into the arms of people, but just don't have the vaccine to do that. And it's really in our own interest across the world to make sure this happens, exactly as Omicron has just now displayed.
Different countries are taking very different approaches to the Omicron strain. In the UK, the US, Japan, there's an emphasis on the booster programme. In other places, for instance, in a province in China, we're seeing very strict lockdowns. What is the right approach?
Well, the right approach is using all of the tools that we have available to us without having to resort to extreme measures. But also, there will be steps that may be needed to curb transmission and to bring it down to stable levels. And it's ensuring that stability that's going to be important. No one wants us to be swinging from one extreme to the other. We all want some stability in our lives, and we need to have policies that drive us toward that end.
Dr. Catherine Smallwood, thank you very much for joining us.
Thank you.